Okay, good evening, everyone. Welcome to the Rescue Consortium meeting, special meeting to discuss what's happened with the future of EMS at Rescue. I thank you all. Louder? Okay. I thank you all for coming this evening. And if I will just ask, as we go through the presentation, if you have questions about an issue that's brought forward, and you would like clarification, please ask your question at the time that issue is being discussed. There will be a general question and answer period at the end of the meeting for just an understanding of the whole oversight of the process here. But yes, if you do have a specific question that will clarify an issue, please ask it at the time. Just raise your hand and hopefully we can get the microphone out to you. That said, I'm going to turn you over to Chief Hazelton and let him kind of fill you in on what's happened and where we're going.
Thank you. Before we get started, I'd like to take an opportunity to introduce a couple of guests. So first, over here, Vern Bristol, one of our founding members of Rescue Inc., and he was part of the brains behind creating this amazing organization that serves so many communities. So maybe a quick round of applause for Vern and the work that he did to set this up. And then we also have the pleasure of having our state EMS director here, Will Moran. He indicated he's willing to answer any questions about state government that you would like answered. And the other gentleman from District 13, our new chair, Tom Goddard. So as we go through the discussion this evening, and I want to make sure that you understand it's a discussion this evening, we can certainly ask any of our experts about Rescue, how it was created, state legislation, or local EMS. I think it's really important that we understand the mission of Rescue Inc. and the work that we do in all of our communities to fulfill that mission. All right, so when you think of rescue, you think of that accident, the stroke, the heart attack, and calling 911. People really associate EMS and ambulance work with that type of emergency. But it's important to understand that EMS is more than just the 911 call. That's certainly part of what we do, but EMS is a system. Rescue Inc. provides a comprehensive response to out-of-hospital healthcare needs in our communities. And that includes the 911 response, hospital-to-hospital transport, which is quite often overlooked as a critical EMS role, large incident response. We've had fires, we've had bus accidents, we've had nursing homes that needed to be evacuated. We've had floods that required relocating people in wheelchairs with medical equipment. That falls on EMS. Event coverage. Every time there's a parade, a protest, every time there's a large gathering, EMS is tasked to provide the first aid. We're tasked to help reunite lost parents with their children. Specialized rescue. We're humans. And if you can find a place in the beautiful Green Mountains of Vermont to get hurt, whether that's in a river or on a mountaintop, somebody will do that. Our specialized rescue teams are trained and equipped to go to where our patients are. Whether that's trapped on a rock, on the top of a cliff, or lost in the forest, we take our medicine to them. We provide education, not only education for EMS providers, for workforce development and first response agencies, but we provide education for the public through CPR, Stop the Bleed, and other safety-related programs to prevent injury and illness. And most recently, over the last 2 years, our role in public health has been large. Rescue has participated in delivering vaccines to people that are unable to get out of their homes, mobile clinics in 140 communities in every county in the state of Vermont. Our monoclonal antibody teams right now are operating out of St. Johnsbury, Burlington, Rutland, and Brattleboro, providing the life-saving treatment for COVID-19. EMS is more than a 911 call. It's a comprehensive system of out-of-hospital care, and that's what we provide. We do this at a couple locations. We have our office here in Brattleboro, which currently serves 9 communities, and we have another office in Townsend, which serves the upper West River Valley. They don't work independent of each other. They're part of one system that shares resources, shares personnel, and shares the responsibility we have to the community. EMS is the true safety net in our community. Those without insurance, those without means, those people that have a crisis, whether that's a medical condition, a mental health issue, substance abuse, EMS is here and will respond. It's really one of the only sectors where, regardless of the reason, regardless of the time, you can see a healthcare provider 24 hours a day without appointment. And if you need that appointment again tomorrow, we're here tomorrow as well. A lot goes into this. This is more complicated than putting a person in the back of an ambulance. A typical 911 call is a complicated series of events that starts with somebody having probably the worst day of their life. Somebody struggling to breathe. Somebody that fell off a roof. Or somebody that got lost in the woods. It goes through a 911 process where the dispatcher asks questions, gathers information, determines the level and the nature of the emergency. That information gets relayed to first response agencies. Many of our fire departments who have medically trained personnel that can get there quickly and provide life-saving and stabilizing treatment. It then filters through at the same time to the ambulance. In this building, we have response algorithms that take the information that our 911 operators gathered to determine what level of response is best and most appropriate. Not every patient requires the highest level of care. Not every patient requires an ambulance with lights and sirens. In fact, many do not. And by using an algorithm that has been proven over 50 years of response in this area, we're able to prioritize our responses and put the appropriate personnel and equipment at the scene of the incident anywhere in our 15-member towns. As more information is obtained by the dispatcher as they stay on the phone, we get updates. Those updates turn into changes in response modes, additional resources, and then first response will quite often arrive, start treatment, and report back to the ambulance crews what they're seeing. There's a patient turnover. This is very common practice in healthcare, where one healthcare provider will start care, gather information, and provide that in a responsible and respectful manner to the next healthcare provider in line. It happens in our hospitals when ER patients go from the ER to the floor. It happens when you go from surgery from pre-op to the surgery to post-op. Transition of care is part of healthcare. It is normal, it is effective, and it is safe, as long as all the parties understand the importance of patient turnover. Once we've assessed the patient, we determine the plan. That assessment of our patient may involve simple, hands-on physical assessment, a lot of information gathering, questions, and storytelling. We assess the house, the living conditions. We look at the surroundings to determine if there may be an environmental cause. We truly engage with the patient to determine what is causing their need for an ambulance. Nobody wants to call 911. They called for a reason. It may be a chronic health condition that has gotten worse. It may be a new acute condition that's bothering them. So we do that evaluation. Sometimes we use advanced technology, like you see over here on the table, with cardiac monitors, 12-lead EKGs, ultrasound, and other tools that allow us to better diagnose the ailments of our patient so that we can direct the appropriate treatment and the appropriate destination for their care. The transport is not a ride to the hospital. The transport is not somebody being picked up and put in the back of a hearse as it was in 1966. The transport of a patient in our system is healthcare. It is high-level, ICU quality healthcare, where assessment is done, treatment is provided to those that require treatment. Risks of treatment and procedures are assessed, and that patient is then brought to a hospital. And we once again turn that patient over, explaining the treatment plan that we're working from, explaining the assessment that we've done, the medications that we've given them, and what we believe their next course should be. Sometimes that means calling ahead for a surgeon once you've identified the need. Sometimes that's calling ahead to send a patient directly to a cardiac cath lab, bypassing the local emergency room altogether. Because we can definitively determine with our assessment skills and our equipment that that person needs a level of care that is not available here in our area. When that's done, it's not as simple as getting back in your ambulance and going to the next call. That process takes time. In order to advocate for our patients, we must stay at their bedsides. We must make sure that that information is transferred. We must provide. That patient's not doing well. we provide written documentation to the hospital staff to make sure that medication errors aren't made, to make sure that the patient's information is appropriately ends up in their charts so that their care can be continued. Then we have to decontaminate our ambulances. Certainly in the world of COVID, we've transported dozens and dozens and dozens of COVID positive patients. And I can say with 100% certainty that every time we've transported a patient, our crews have sterilized those ambulances so that we reduce the risk of transmission or eliminate the risk of transmission between our patients. People can get in the back of one of our ambulances during their medical emergency and know that they are not going to receive a communicable disease like COVID because of it. It takes time. It doesn't happen in a minute. It doesn't happen in 2 or 3 minutes. Cleaning and sterilizing these trucks is part of what we do to keep everybody safe. I've said this for the last 5 years, 6 years, I don't even remember now. Our model works. Our model has worked. Our model will continue to work. We've provided 100% response to 911 calls in all 15 of our member towns. Every person that has called for an ambulance has received a Rescue Inc. ambulance and crew to provide their treatment and transportation. While doing that, we've also responded, like I said a few slides ago, to many other types of calls. We have dedicated teams and personnel. We have 78 members in our organization, so we have the bench depth to be able to field not only EMS crews, but specialty rescue crews, response crews. So while providing emergency coverage in this area last year, we had a hurricane that was supposed to come through and flooding. This building was staffed with 28 providers to make sure that whatever happened in this region, if the area was cut off, if the roads were flooded, we could set up camp, we could set up base camp, first aid locations like we did during Irene, and provide forward treatment areas for those people that were sick. We had boats on the ground, we had swiftwater rescue technicians and flood rescue specialists here. That's part of what we do for the 15 communities. In Vernon last year, just as an example, we stood by in body armor for hours waiting for a standoff. Our personnel is trained in how to manage and how to work in warm zones so that we can work with law enforcement to get to those people that are injured during those incidents quicker. We don't have to wait until the entire threat is mitigated because we have the equipment, the training, and the personnel that can work side by side with law enforcement in those conditions to support our citizens that we serve. We have other resources, and those resources we don't keep only here in our area, but we support across the state, including search and rescue resources that travel and assist Vermont State Police as part of the statewide search resource in Vermont. Our swiftwater rescue teams are part of Vermont's overall flood rescue plan. As a state team, we're deployed all over the state to respond to crisis or flooding anywhere in Vermont. Our rope teams provide support to Vermont State Police and State USAR. We don't usually spend a lot of time bragging about the experience, but over the last month, we've seen a lot of information come out, and I think it's really important that I highlight a few members of our management team and the roles they have and why it matters. Our quality assurance, the person that looks over and makes sure that every run, every patient receives the highest possible quality care in our system is Mark Considine. Over 30 years of experience in this system as a paramedic. He's a board certified critical care paramedic. There is nobody better. There is nobody better to provide clinical oversight for paramedics than Mark Considine. Quality assurance is key to high quality EMS delivery. And that brings me backwards to Mark Burdick, our training officer. Because unless you have follow through, unless you have a mentor for those people so they can learn from their calls, so that they can understand the depth of knowledge that we expect them to understand, this system doesn't work. Our operations folks, they've only been paramedics for 4 years, Emily and Eric. They're the newbies in our crowd. They come with 10, 15, I don't even know, 20 years of emergency response. But to us, they're some of our newest paramedics in the management team. I've worked in this system as a paramedic for 22 years. I'm board certified critical care. I'm from this valley. I've been working as a volunteer in this valley for 27 years. We know this community. We know what this community needs. We know what this community uses for services, and we know how to deliver those services. And we do it with 100% response rate every day. 6,000 calls 2 years of a global pandemic, and not a single mutual aid call. I'm gonna put Will on the spot. Any other services that you know of that have made that? The reliability that we provide our 15 towns, the reliability that we provide to our community is second to none. It's been that way, and it will continue to be that way. We are committed to the people that we serve. We do it with a lot of equipment. Some of it's here today, some of it's at our Townsend office. Some of it right now is being hosted for us at Putney Fire. Some of it is spread out around the state. We have equipment currently in Rutland. But we have the equipment to support the personnel and make the mission work, including 9 ambulances, multiple staff vehicles, technical rescue equipment, boats, COVID response, and mobile infusion units. We've got a lot of experience and a lot of people. In order to be able to provide service to this community, we need depth. We need to be able to respond to those surges. When Valley Cares catches fire and we suddenly have to move 56 residents, you've got to have people. We're in a people business. The good news is you can't outsource EMS. Unless they have a self-driving ambulance we don't know about yet. But you can't outsource EMS. It's a people business. When there's a 911 call, when there's a flood, when there's somebody stuck on the side of a mountain, or when there's a person that needs to get to Dartmouth for a cardiac cath, it requires people. We have those people. We have those people that live in our community, that respond to our calls for assistance. We call it an all call. So right now, if we were to have multiple calls, we could put out an all call, and our 78 providers will come back to support the community. How do we hit 100%? We hit 100% because of the commitment and the dedication of the personnel that make up this organization. We hit 100% because when somebody has a need, we are committed to meeting that need. We don't wait until there's another call. If all of the ambulances suddenly left here to go on emergency calls, one of our 78 people or several of our 78 people will come in and stand by in the next ambulance, even though there's not a call. Because when that call comes, we want to be ready, we want to be standing by that ambulance, and we want to meet our objective of being out of this building in less than 2 minutes. Our average time from that tone goes off until that ambulance goes out the door is 1 minute and 30 seconds. And that includes calls that come in the middle of the night. The dedication of these people, I can't overemphasize. 5 critical care paramedics, 11 additional paramedics, 21 AEMTs, 38 EMTs, 3 EMRs. Some of our people, they live here, they work here, they're part of your community, they're on your local fire departments, they teach in your local schools. Our people are integrated into what happens throughout our member towns. Put a plug in here for EMS Week. Thank you to the people of this organization that make this happen. I'm going to stop there before, I'll go back one, leave that slide up. Does anybody have questions about the services that Rescue Inc. provides? The organization is healthy, the organization is committed, and the organization will continue to succeed in our mission. If there's anything I can get across to you tonight, it is that we are committed to providing the highest level emergency medical services, the entire package, to our member towns. But things have changed, which is probably what brought most of you here. Our system is not going to be the same as it has been for the last 56 years. What does that mean for rescue? What does that mean for you? What does it mean for the citizens of the towns that we continue to serve? Well, in order to dig into that, I want to step back and look at a couple things. There's a national workforce shortage in EMS. I could read this to you, but I'm just going to read a line here because I think it's important. This study found at 20,000 employees, overall turnover among paramedics and EMTs ranges from 20 to 30% annually, meaning 100% turnover in 4 years. This comes out of a document that the American Ambulance Association sent off to our federally elected officials. The other slide shows what's happening in workforce right now. The workforce market in EMS is so tight that you're seeing 42% pay increases in EMS. You're seeing people that are struggling to get service providers and the cost of delivery going up. It's important to note that in EMS, especially in this area of EMS, in Windham County, our population is older and poorer than most other areas, which means the vast majority of people that we serve are covered by federal insurance plans, Medicare, and the state-run federal program, Medicaid. Those programs have set their reimbursement rates intentionally. Medicare sets their rate at 80% of the cost of delivery. That is by design. In Vermont, Medicaid's rate is 80% of the Medicare rate. The system is built to underfund EMS, something we've been working with our federal partners for years through a process called cost data collection to fix. It still exists today. It's going to exist for the next 5 years, which means every patient we see with Medicare or Medicaid is being reimbursed at least 20% less than the cost of delivery. Medicaid patients, 40% less than the cost of delivery. With that, this year, the month of April, the federal government reduced reimbursements by 1% at a time where our workforce costs have gone up by 20, 30, and 40%. In the month of June, the federal government is removing another 1% in order to catch up with sequestration that was suspended during the pandemic. We know we have a workforce crisis across the country. I'm very pleased to say here at Rescue, our ambulances go out the door with 100% reliability. Our staff is dedicated. As you can see from the numbers on the wall, our staff doesn't leave Rescue. Our staff doesn't turn over as much as other services. At the paramedic level, our paramedics stick around 30 years. Joe Thompson in the back of the room. How many years, Joe? 40 years. I had the pleasure a couple weeks ago of going to Washington, D.C., where Joe received an award for the service he's provided this community after 40 years. Our people are committed. This organization is a nonprofit. It's a mission-driven nonprofit organization that's governed by a board of trustees. We couldn't do the work that we do if it wasn't for the dedicated people that oversee how this operation runs. I'm going to ask the trustees in the room, please stand up. If not, I'm going to call you out by name. Thank you. This dedicated group of people come in every single month, some of them every single day, and they look at every aspect of our organization, from service delivery to finance. They guide the organization, the direction of the organization, and they work not only as members of our board of trustees, but as representatives for the towns that they come from. The organization here at Rescue is unique in the sense that every member town gets to appoint a representative to our board of trustees. Every member town gets direct insight into the daily operations through their board of trustees member. At any point, if you have a question, and I'm speaking to the select board members, you can always reach out to your board member. That's why they're here. And if you see a seat up here that says vacant, it's your responsibility to fill it. So there's a lot of talk about money and costs. I think it's important to understand that Rescue Inc. is stable. Our fee structure is stable. Through economic downturn, through a housing boom bust, through a global pandemic, we're stable. The rates we're charging our towns is nearly flat. A 1%, less than 1% average annual increase over the last decade. I would dare say you're gonna have a hard time finding another service, another critical piece of, whether you want to call it state or local government, that has managed to maintain a 1% year over year for a decade. We're really proud of how well we operate this organization, how fiscally responsible we are, and the consideration we give to the tax base. We don't come back to the towns and ask for 20, 30, 40% increases year over year, like you're seeing across other areas of Vermont and certainly around the country. This is a slide that we showed you for people that were here at our September meeting. So this is not a new slide. This is another slide we showed you in the fall, but I think it's important because of the questions that have been raised about where do those numbers come from? Those numbers come from a very simple calculation. Your census numbers and a per capita rate. So some towns this year, because of the census, saw their numbers go down. You have less people than you did in the last census. It's a simple multiplier, your numbers went down. If you have more people moving into your community, then your numbers may have gone up. We increased the base rate, that $24.02 or that $29.50 by 1%. That's how the calculation is made. That's how we explained it to everybody in September. That's how we've explained it to everybody in the last 5 years that we've been doing these open town meetings, 6 years, 8, I don't know, many, many years. Are there questions on how the rate is created? Yes?
Is there fluctuation between the smaller towns? Brattleboro has its own rate, but...
Oh, that's a great question. Oh, that's loud. So those are the Townsend and Brattleboro are the base areas. So if you're served out of our Townsend office, the rate is $29.50. If you're served out of our Brattleboro office, it is $24.02. That dates back to 2005 when Rescue was approached by Grace Cottage about taking on the ambulance service for that area. And at that time, the rate was set slightly higher than this rate that was being offered down in the Brattleboro catchment area. And since then, because again, the Board of Trustees has set that rate at 1%, that number simply has grown by 1%. So it dates back to the original agreement with Grace Cottage and the towns up there in 2005. Other questions? Yes?
So will just fundamentally, is the rate going to change?
So
With Brattleboro leaving, we have a delta, right? We lose money. So will that change?
the rate is not going to change. So we have many contracts that are already back. We are not changing the rate that we are charging our member towns this year.
3 years.
We have 3 years. So those towns that have committed to rescue for 3 years, we are committed to you for 3 years.
Thank you.
We will, as we move forward, continue to have these meetings. We will continue to explain the impacts of Brattleboro's decision on rescue and what that may look like going forward. But in the next 3 years, what we promised was 0%, 1%, and 1%, and we intend to stick to that. Yes?
That's good news. And I'm sure all the towns appreciate that, but in reality, you're losing a pretty good chunk of change. How are you making up that chunk of change? Are you making it up through your reserves? Are you going to go into your bank account and do that? And what does that do to your capital improvements? What does that do to your other purchases? What does that do to your ability to recruit? So thank you for keeping the rates the same, but how is it going to affect other parts of the operation and your fiscal stability?
That is a great question. And that is by far the most complicated question you could ask me tonight. So the answer to that is we are not completely certain how we're going to make up the loss in revenue. But it's also important to know that it's very difficult to know exactly what that lost revenue is. And I'm just going to explain this because I think it's worth understanding that we serve a single community that happens to be 15 towns. We don't serve individual towns, so when we pick up patients, we don't have a Brattleboro book and a Dummerston book and a Newfane book. We have rescuing patients over 15 communities. So we know that we're going to be losing revenue in Brattleboro. We certainly know that the $240,000 that we receive in subsidy from Brattleboro is going to be lost. Exactly what that means, we're going to have to wait and see as those numbers change over the first 3 or 4 months of our next fiscal year. We are very fortunate right now because of the work that's been done by the staff, because of the programs that we've been successful at running across the state through COVID, that we do have a little bit of reserve that's going to be able to carry us forward. It's going to give us the opportunity to invest in further growth of the organization. It's going to also give us the opportunity to kind of wait and see a little bit as to what this looks like early summer and early fall. Hopefully at our fall meeting, which will be late September, early October, we'll be able to give you a really clear idea of what that loss looks like and what it may look like moving forward. Sorry to dodge your question, but yep. Yes. Yeah.
What's the population of the 15 towns you're serving?
About 32,000.
And how much of that population is in the Brattleboro area?
12,000, plus or minus a few hundred.
That's
A third.
a third is Brattleboro town.
Yes.
But what about those who are being charged the Brattleboro area rate?
Oh, that I don't know off the top of my head. Yes.
With some of us, or most of us in the room, having ARPA money, which is a little more flexible than we initially thought, has any consideration been given as to a consistent, perhaps additional amount of money that towns can dedicate to this organization out of that money that would make everybody's life more predictable?
That has not been considered on our side, but I'm would be glad to discuss that with you if that's something that the towns are willing to look at.
Well, that's one of the, I think, of the 64 criteria that were offered in the program. I believe that was one of those dedicated items. So I know in our town, we've wondered that very question, which is in part why I'm here. It's nice of you not to ask up front, but at some point, as the gentleman over there aptly said, the numbers have got to come together and make some kind of sense, and there's going to be results of that. And if there's a manner in which any potential shortfall that may be dramatic can be alleviated by towns looking at this in a more active, proactive support posture to the organization and the citizens in their communities, that may be an option that people would want to reflect on.
I think that's a great suggestion, and I definitely think it's worth looking at if, as we move forward and kind of determine what that hole is going to look like. So rescue operates, so the way our subsidies work, it's about 18% of our operation is covered through our subsidies. That is an important component of how we deliver these services. So we provide a lot of uninsured, a lot of underinsured, and a lot of charity care. And those dollars that we receive through that subsidy, that 18%, does help us sustain those programs. That's what allows us to continue operating with the number of services that we provide that we can't charge for. And there's somebody in the back, I said? No? No hands? Okay. Great questions. Any other questions on the assessments, how we get there? Yeah.
Are you guys looking to expand to other counties perhaps, or to other cities to offset these losses?
So at this point, we are looking at a lot of different possibilities. It's important for us to, be realistic with what we can and what we can't do, what we have the ability to do. So the Board of Trustees has asked me to look at all possible ways of bringing additional revenue into the organization to stabilize what we know is going to be a loss. So the answer to your question is yes, we are going to consider just about any potential revenue source that is available out there.
What's your total operating budget? You're saying you're losing 250 or 240? What out of how much? So
total operating budget is about $3.5 million. So the loss of the subsidy is going to be about $240,000, and then there'll certainly be a loss of patient revenue that we would generally receive through providing those direct services. And that's the number that's much harder to pin down because of the way that we keep our books. It doesn't separate it, so we can't really get an exact number. Yeah.
Last question, I promise.
No, keep asking. I'm here all night.
When you have a motor vehicle accident, in that patient or patients, well, a patient, we'll use one, is a Medicare recipient, you receive a reimbursement of 80% of your actual cost from Medicare. Do you also bill, which would be appropriate, the insurance company of the motor vehicle? And to make up that difference or to give you a little cushion?
So the answer is we can't balance bill to the insurance company under Medicare rules. We can bill automotive insurance for motor vehicle accidents in certain situations, and that is really a timing thing. So it depends on whether the hospital gets to it first or we get to it first. And that's the challenge, because generally those have very low limits as to what their medical coverage is. And in an ideal world, we get to them first, but that's not generally how it works out.
Thank you.
They're better at billing than we are. Other questions? All right, so I'm going to put you through a little bit of what the timeline looks like, how we got to this point. And this is for information. If you have questions, feel free to ask, and we will certainly try to answer everything as best we can. So by now, I'm sure reading one of many media outlets or watching the select board meetings on BCTV. Certainly people that were in the room, we had a meeting last September to discuss the finances, what those rates look like right in this very room. And certainly the conversation that came up, it was an agenda item, was Brattleboro's desire at that time to put paramedics on the fire trucks. Peter Elwell, town manager at the time, spoke to that discussion, was very clear about Brattleboro's intentions were to support the community, not to disrupt the long-standing relationship with rescue as part of their desire to put paramedics on the fire engines. We did have a discussion at that time about the 3-year agreement, that was going to be at 0%, 1%, and 1%, and certainly Peter Elwell at the time was in support of that on behalf of Brattleboro. As all of you select board members know, we sent you a letter telling you, like, yes, we have agreed, that is what our board, because the way those meetings work, we listen to everybody here. Shortly after that meeting, the Board of Trustees gets together, and at the end of the day, the Board of Trustees sets the rates. That is one of the responsibilities of your representatives, is to set that rate. So we sent you a letter in December letting you know that yes, in fact, the Board of Trustees had agreed and set the rates for the next 3 years for at 0% for the first year, 1% for the second year, and 1% for the third year. The Brattleboro Select Board put that amount of money in their budget. So again, there's no indication to us that this was going to change. The language that was spoken in this room, and certainly the information that was provided, was that there was no change coming. We had a conversation about operational letters of agreement, and because Tom is here, I want to put him on the spot and ask him, how common are operational letters of agreement?
How common?
Yes.
They're done every year.
Every year, right? And they typically work where we send them out. It's a template. We send them out. They come back. Then we forward them up to Will in his office. They put them in a file somewhere, and they sit around. And basically what those operational letter of agreements say is, if there's a call in the town and there's a first response squad, the first response squad will show up, and when the ambulance service arrives, there will be an appropriate clinical turnover at that time, and then the ambulance will take over patient care and we will move on. We had some struggles this year around the language of the operational letter of agreement. We've been having struggles with that patient turnover, that really critical, important time where patients get moved. To the point where we actually reached out to the EMS office for assistance to clarify why it was so difficult to get a letter of agreement with Brattleboro. Meanwhile, every other town had already signed that and submitted it. Challenging. In the words of Will at the time, highly unusual. So we moved away from that, and we got a meeting, a sit-down discussion, my first opportunity to meet Brattleboro's new town manager, and we worked out some details and managed to get an operational letter of agreement signed on the 18th of January. That operational letter of agreement goes for 3 years. Certainly an indication to me that we were going to be moving forward with a relationship for 3 years, and that was on the 18th of January. But there was something strange at that meeting. And what was strange at that meeting was the conversation. I reached back out to the assistant town manager the next day and said, hey, I think we need to have a meeting, because I'm not really feeling like things are as good as they were a year ago. Like the new guy doesn't seem to be as comfortable. So we did that on the 19th of January. A couple weeks later, we got a request for a lunch meeting to talk about the contract. So I printed off the meeting slides from last September, thinking that the new town manager wanted some background information about what rescue services are provided, what information we had given to all of you already. So I printed off the exact same slide presentation we talked about a year ago. I grabbed the Brattleboro town rep, because the Brattleboro town rep, hi Deb right there, Brattleboro town rep, and said, let's go to the meeting, since she hadn't had an opportunity to meet the town manager. We went to that meeting. We sat down at lunch thinking that we were going to have a conversation about the services like we did earlier, and we were told Brattleboro's decided they're not going to pay you anymore. based on his assessment, he believed that we were making money in the town of Brattleboro, and because of that, they were not going to cover the assessment that they had already agreed to pay. In fact, they told us that if we needed that, as I explained to them, that's part of the money we use to provide services like charitable care, uninsured, and to keep this operation running. He suggested, he told us that we should just cost shift that to the remaining towns. Something that we are not okay doing.
I'm sorry, what was that?
What's that? That we are not okay cost shifting to the rest of our community.
What did he, what was their suggestion?
That we cost shift. We take Brattleboro's $40,000, spread it across the other towns. Something that, again, we are not comfortable doing. Question, yes?
I'm curious, how transparent are your books?
I'm sorry?
How transparent are the books that the city manager would have asked about maybe making too much money as a first response agency? So
the answer about the books is the town manager was informed that the books of rescue are here. Any town certainly have a representative that sits on the board. So every third Tuesday of the month, the Brattleboro representative goes through those books. We have audited financials, which are also provided directly to our board of directors. And that information is available through the board chair, as it has been for the last 56 years.
We do follow 990
Yep.
as required by law.
The other component is that request never came. The last communication we had with the town of Brattleboro was when we shook hands, paid for lunch, and walked away. There was never a request for information. There was never a reach out to the board until today. The board representative, there was never a call to our chair. There was never a call, email, or text message sent to me. On behalf of the board, at their instruction, I sent the town a letter saying we cannot provide services for free, and we will not cost shift those to our other communities. And if that is the position Brattleboro is taking, we cannot provide service. And invited them to a conversation. I invited them to come here and meet with us and discuss what it was that their issue was. We found out, like everybody else here, the same day when the press release went out, that Brattleboro decided to go forward with a fire-based EMS system. We had no prior knowledge of that. We didn't get a reply from them. We found out, in fact, I found out through the Reformer when I got a request for comment. That's the timeline. We have not heard from Brattleboro officially in any capacity. We weren't asked to participate in any of the town meetings, the forums, though we were present, sitting in the background waiting for questions. It wasn't our meeting. It wasn't our time. They certainly were not looking for our opinion. Let's give that a second. Can we be done now? Okay, it's gonna be quiet enough. All right, today was the first official communication we received. The board chair and I received a letter requesting mutual aid services to the town of Brattleboro. Something that any system should have, would have, could have thought of before they designed a new EMS system. What happens when there's a fire and an ambulance call at the same time? What happens when you have multiple calls? What happens when there's a disaster and you need 4, 5, 6, 8, 10 ambulances? Something that we all understand. Something that every person in a blue shirt in this building gets. We've been doing it for 56 years. We have a system of response to cover those calls with 100% success. They asked us today to set up a meeting to talk about how to cover the calls they can't. A conversation we're going to have with them. But a conversation about how you are going to subsidize their service. And my question is, do the other towns want to subsidize their service. Because what we've been asked to, and I will say I got a little bit irritated. And I think I have a right to be irritated. Because my reply is that a reasonable request? Is it reasonable to dissolve a 56-year relationship without any discussion and then ask us to provide the backup coverage you need because your new system won't support the needs of your community? Is it reasonable? And I'll leave it at that because I'm sure there's opinions about whether it is or not. So that is the timeline. Yes, is there a question? Oh. So let me explain what it means, and then we'll certainly answer your questions. So here it is in writing in case somebody wants to look it up. That's the timeline of communication. That's how we got to this point, except for today, because it came at 1 o'clock and this slide presentation was done already. Fresh off the presses. So just to clarify, because I think it's important, Brattleboro's fee for service, same as everybody else's, $24.02. I'm sorry, same with everybody else's that's served out of Brattleboro. $24.02. The difference in Brattleboro, though, which is different than every other community, is we actually paid back Brattleboro. We gave Brattleboro $48,000 back, so they're still getting a discount. So even though they were paying the same as everybody else, they really weren't. So Brattleboro Dispatch, everybody else in our area uses Keene Mutual Aid. You pay those fees directly to Keene Mutual Aid. Brattleboro does not. And they bill us $48,000 a year for the privilege of being dispatched. The good news is that will not be part of our deficit in July because we won't need to pay that service fee anymore. Yep.
Rattle off the 15 towns that we're talking about?
Oh yeah, Vernon, Guilford, Halifax, Brattleboro, Dummerston, Newfane, Wardsboro, Stratton, Jamaica, Townsend, Brookline. Did I get Newfane already? I'm going in a circle.
Okay.
Newfane, Putney, Chesterfield, and Hinsdale. Marlboro. Man. Yeah. All right. You screwed me up. I was trying to do my geography going around in the circle here. Yes. Don't forget Marlboro. All right. So there are a couple other things I want to get out there because I've heard statements about critical care doesn't matter. Ultrasound programs don't matter. Subscriptions don't matter. You know what? This matters. This is important. It's important not only for us, it's important for our patients. Having providers at the critical care level means they have a scope of knowledge that far exceeds somebody coming out of paramedic school. It means they have the experience to be able to provide ICU level treatment. That means operating ventilators, multiple medication drips, monitoring internal pressures, monitoring the most complex patients that we have. That translates to better care. That translates to the ability to understand and assess patients at a level that you can't get if you're not at the critical care level. Here at Rescue, we have an ultrasound program. It's the new, upcoming, exciting tool. But more than that, it's how we engage our providers in more learning. Not only now can we assess from the outside, we can assess from the inside. We can tell whether that person has a bleed in their abdomen that's going to need a surgeon. We can tell if that person that's in cardiac arrest has muscle function or not. Some of what I read in the paper was, oh, these are only for interfacility transports. No, they're not. This training, this education, and these tools help us provide better care to our patients before the hospital, in the emergency realm, between the hospitals, when we're taking them to a facility, as well as the knowledge, the education, and the experience in helping us better teach and better respond in our community. And then subscriptions. I'm sure everybody's heard of our subscription program. Our subscription program is here and built and designed to help our citizens control the cost of ambulance transport. What people may or may not know is that when you work with the federal government, you have to follow a whole bunch of rules. If you receive federal payments, they get to dictate almost everything. One of the things they dictate is that we have to bill and collect in a certain way. If we're going to bill the federal government, we're required to bill everybody. You can't pick one or the other. You can't discriminate whether you bill or not. If you're billing everybody. And if you're billing, you can't bill somebody less than what you bill the federal government because their rules say they get the lowest rate out there. What that means is I can't discount your ambulance ride. Now, if you are a low-income person that has doesn't have the ability to pay, we have charitable care. That's part of what our subsidies go to. You can come in, you can show us that you have a financial need. Again, a program that is designed by the federal government that we work through. And based on your financial need, you can have parts of your bill forgiven or all of your bill forgiven as part of our charitable care program. Our subscription program allows everybody access to the benefit of security when it comes to using an ambulance, especially our fixed income seniors. That service covers three, Ellen nod, three 911 calls. So if they have an emergency at home, whatever their insurance doesn't cover, the subscription covers, and I'll explain that in a minute. If they need to go from here to Dartmouth, the subscription will cover it. But sometimes even more important than that, when they have that hip surgery and want to come home and be rehabbed at a local facility so that they can be near their friends and their family, it covers that too. And the way that works, the way that has to work, is your subscription dollars come into the organization and they get put in a pool. And if I need an ambulance and I'm in that pool and the bill that my insurance company doesn't pay, it's $500, then we take $500 out of the pool and we pay the bill with it. That's how the subscription works. You're sharing with your friends. Hopefully, you don't need that service. But if you do need that service, you have peace of mind knowing that whatever is not covered by your insurance company is covered by your subscription. We have fixed income seniors, low income people that rely on that service because they rely on us to provide their health care. It's critical and it's important for our community. All right, so what this means for Brattleboro, July 1st, we're not doing 911 calls. We will not be responding to Brattleboro. We won't be doing fire scene standbys, and we will not be doing unreimbursed event coverage. Everybody here, all the towns that are part of our member towns, if you have a parade, if you have a protest, if you have a large gathering, and you request an EMS presence, we love events. Our bike team will go out, we'll put our UTV out there, we'll walk around, we'll meet with people, we'll provide first aid, we'll scoop up the kids that are missing and give them back to their parents. People in the town of Brattleboro will no longer have the luxury of a subscription program to cover those costs. So if they need an ambulance, they're going to have to pay the bill. They have to be billed. It's required by law that they be billed. They're not going to have the resources that rescue provides for large events. We have the capacity with our mass casualty unit. We can treat 75 patients at a time. We can shelter them. We have tents. We have heaters and air conditioners. On the hottest days of summer, we can create ice cubes. On the coldest days in the winter, we can create warmth. So when you have a nursing home that needs to be evacuated and no place yet to take them, we have the infrastructure that we can set up, we can heat it, we can air condition it. If it's dark, we have lights. So those people can be away from the elements while we arrange their transportation to another place. We transport patients for evacuations. on the 1st of July, Brattleboro doesn't receive those services. Our member towns will continue receiving the services that they will. In Brattleboro, we're going to continue doing our interfacility transports. The new arrangement in Brattleboro will not get patients to definitive care. The new arrangement will only get patients to the local hospital. If you're dying from a traumatic injury or having a heart attack, all that means is you're going to die at the hospital from the same traumatic injury or heart attack. Patients need definitive care, and we're committed to providing that definitive care, and we'll be taking those patients from the hospital to where they need to go. We'll get them back to rehab or hospice. We're committed to our patients and we'll continue. Our subscription program is going out to the citizens of Brattleboro because it's critically important to their ability to go from hospital to hospital and get back to rehabs. They'll have to understand that they won't have the advantage of coverage for their 911 calls, but they will for the other services. Our pediatric programs, car seats, fittings, our Kids Safe programs will continue to operate in Brattleboro and certainly be available to Brattleboro residents. We're not abandoning the citizens of Brattleboro. So that is the end of what I have to say. And I would like to open it up to any questions that you might have. Please understand that we have guests, so if you would like to query our guests, I will put them on the spot and make sure that they are willing to answer. Yes?
Are you considering offering certain services to Brattleboro on a cost-plus basis?
Well, that's a loaded question.
So at this time, that determination has not been made by the board of directors. Is that a fair answer?
That's fair.
Okay. But it's certainly something that I've given some consideration to. I do not believe, as I said earlier, that it is a reasonable request to ask the communities that have been part of this partnership for 56 years that have been left high and dry to cover the costs of backup services to Brattleboro. I think that's unreasonable. At some point, after the board has an opportunity to meet with the town, that determination will be made by the board, and the representatives certainly represent all of those towns. Yes?
I'd just like to acknowledge the fact that my name's Luke Tyke. I've been part of Rescue as a volunteer since 1980 and have done several stints on the board. And if Brattleboro had made this move even 2 years ago, we would be in a much, much, much more precarious situation right now and not have the luxury to be able to stop and reassess and make the moves that we've made. And it's 100% due to Drew and his ability to have realized the COVID program and jumped on it and put all the resources to it. And this organization owes him a huge thank you.
Any questions? Like, I'll field any question you have to the best of my ability. Yes?
Not to speculate Brattleboro's budget or how things might go in the future, but is there any recourse if they say, "Oh, sorry, we can't actually afford it"?
So I'm going to share. I'm going to share a piece of information because I think it's worth sharing. This got circulated around by some prominent folks in Brattleboro, and Baker City, Oregon. And some people have probably seen this article already. Fire-based EMS system that is now shutting down their fire-based EMS system. And I'll read you a line from it, a couple lines. It says the city hasn't for at least the last couple decades collected the full amount on its bills, largely because the majority of the patients it transports, about 80%, don't have private insurance, but are covered by the 2 federal programs. And it says the shortfall averaged around $730,000 for the past 5 years, and the city projects a $581,000 gap for the fiscal year that ends June 30, 2022. The city in Oregon is the same size as Brattleboro population. Its demographics are similar to Brattleboro, except it has a much lower poverty rate. Every single ambulance system is requiring subsidy. Barrytown, for example, municipally run ambulance service requires $900,000 a year in subsidy. Williston Fire went through a study, in fact, the same study organization that Brattleboro is going to be using, added $1.35 million to their budget this year. So if you're asking for a crystal ball, I can tell you that the numbers that have been put out and the projections that have put out will not work here. The town will have to subsidize, heavily subsidize that operation to make it successful.
Okay.
Yeah.
I have a staffing question. It probably doesn't have anything to do with budgeting. So when a town sends their fire department or their fast squad, or whatever they may have, waiting for you to come, okay? You have 2 people generally on an ambulance. If a patient requires a substantial amount of care, which require 2 people in the back of the bus, how does the bus get to point A?
That's a really good question. So we do, our response model is a 2-person response. So when our ambulances leave, they only have 2 people on them unless we have a training member. So we, as part of our system, work very closely with our first response squads. Most of the time, a local first responder will simply jump on that truck and drive it to the hospital. I've said it for years and I'll continue to say it. The reason we're successful in this area is because we have a system. It's because we work together. It's because I can call Putney Fire right now and ask them to drive our ambulance. In fact, not only do they drive the ambulance, but if I go up there as a paramedic to support that crew, and I drive one of our pickup trucks up, I can get out of the pickup, I leave it on the side of Route 5, and I get in the ambulance to help the crew. Putney Fire will drive that pickup truck back to Brattleboro, and it'll be at the hospital by the time I'm done turning my patient over. And that happens everywhere. The reason we're successful is because of our partnerships and the work that we do with all of those community members. It's not siloing. Like, working together is what's got us here.
Thank you.
Yeah.
So, you said Brattleboro has requested rescue to be on mutual aid for them. And is that a choice for you, or, okay, and so what kind of reimbursement does that get you if you're responding as mutual aid?
So the question is the backup coverage / mutual aid discussion a choice for rescue? And the answer is it is. And Will can nod over there that services do not have to provide that. There's no legal obligation. So that is a discussion for the board as to whether that's going to be provided at a cost or not. Historically, when our system was whole, we provided mutual aid and continue to provide mutual aid to our surrounding towns. And other than our paramedic intercepts, we have not historically had to charge for those services. In fact, the middle of last night, we had an ambulance in the city of Keene because the Keene Fire Department was busy fighting a fire. They needed someone to cover their medical calls. And we've been over there, a half a dozen times in the last 2 months based on their needs. In the wintertime, we quite often will go to Deerfield Valley and support their needs at the ski areas. Moving forward, we may be having to look at a fee-for-service model in order to support our operation with all of our mutual aid. And certainly, I think with the town of Brattleboro and their decision, that's something we need to look at, is what we should be charging. Yes.
So I'm hearing that there's not going to be an increase in costs for the other towns. I'm also hearing that there is, the mutual aid question is still kind of up in the air. But I'm wondering about
what's gonna happen for like large events? Like the event thing, I'm sorry that this keeps coming up, like 4th of July is 3 days after the 1st of July. Right, and that's been a pretty big thing for you guys, for rescue. How is that gonna work?
That's a really good question. So 4th of July is a big event for rescue. We provide parade coverage, we cover the races, we provide coverage at the fireworks. Most of the time we have about 20 people working out of this office on 4th of July because of the events happening. I do not know how that's going to be covered with 2 ambulances and 2 staff members. That's something I'm sure the town will have to look at and figure out how they're going to provide those services. It's really important to make sure that those coverages continue.
This is the kind of the beer barrel effect. People that work for you with the organization work those details. They are extra details. That is extra money for the people that work for you, other than their perhaps salary. What hardship falls on those folks that do a lot of the extra duty, and will you be able to keep them?
So the answer is yes, it will have an effect on our staff and their ability to do those details. So you are correct, we do, because of the way that we schedule, all of those details are extra responsibilities. So when any of those come up, we offer certainly extra pay, overtime pay to cover those. So the staff will be losing that. We're really hopeful that all of our staff will stick around. We have an amazing group of healthcare professionals here. We also have some other exciting stuff going on at Rescue. So Rescue is not stagnant. Rescue's never been stagnant. Since Vern sat around at a kitchen table and came up with this organization, it has been evolving continuously to meet the needs of the community. And like Lou said, 2 years ago, when we had a public health crisis and a hole in the ability to deliver, Rescue responded by filling that vacuum. And it started with a request to serve those communities in Windham County that we already serve. And I told the story in the fall, but we were asked to provide vaccines to homebound people in Windham County. So we did that. And when I called the health department back the next day and said, yeah, we're done. They're like, what do you mean you're done? I'm like, we took care of all those people. They're like, well, how about Windsor County? Can you do that? So the next day we went to Windsor County and I called them up at 5, 6 o'clock. Will, I said, hey, we're done. He's like, done with what? I'm like, Windsor County's done. And then it just kept going. And he's like, hey, how about Bennington? And I'm like, all right, well, Orange County. I'm like, I don't even know where Orange County is. I'm thinking Florida, like Orange County Choppers. Like, I don't even know where Orange County is. Oh, whatever. It's like, so I did say no when he's like, Lamoille. I'm like, no way. I know where that is. Okay, so yes, Rescue is going to continue to evolve, and we are right now. And we're not quite ready to announce what the next big thing here at Rescue is. But the next big thing here at Rescue is going to happen. As an organization, we are healthy. Our staff and our workforce is amazing. And, you can get on any ambulance, go to any clinic, sit in the back of our infusion trailer, and you'll find out that, our staff is amazing. And, what we're going to be doing to support EMS, support the community, support the state of Vermont over the next greatest challenge, which is really where we're focusing, is the next greatest challenge, is going to be pretty awesome. And I look forward to being able to announce that to this group, probably in early July. Good.
Drew, you said 48,000 to dispatch in Brattleboro ends July 1st.
Yes.
So now I call 911. What happens?
Excellent. Since you call 911 in a town that is not Brattleboro, it's going to go through the same 911 operator, and it's going to get transferred to Keene Mutual Aid. Keene Mutual Aid will be taking over all of our dispatching on July 1st. So we have, in order to prepare for that, we still have to do some work because our stations are not equipped to be dispatched by Keene Mutual Aid. So we have new hardware that will be installed. You can actually probably see some of the wires because the electricians have been here trying to get us ready for that July 1st transition. Yeah.
I am curious, the opinion of your law enforcement and your hospitals, your state health authority, how are they preparing for this?
Well, I have the state health authority, so I'll give him a microphone. You aren't going to get away with no microphone.
Can you just ask that question one more time? How are we preparing for the transition?
Sure, yes. The state law enforcement or ERs.
I certainly can't speak to law enforcement or the emergency departments. You know, from the regulatory standpoint, from the state's standpoint, our job is to support all the parties, right? So I talk to them just about every day, whether it's about EMS-related issues or delivering monoclonal antibody therapeutics to folks in Franklin County, right? So the furthest, state county from here. So when it comes to this transition that this community is going to go through, our role is to support this organization as well as the town of Brattleboro in its decision to stand up a fire-based ambulance service. But the decisions as far as operations, right, the staffing equipment, purchasing equipment, the staffing personnel, the level to which they'll be trained, those are all local decisions. We just provide the framework for them to be able to operate the service. We do provide consultation. It's not uncommon to take questions from select board members, elected officials, folks like that who are inquiring about decision making. So we provide consultation, but at the end of the day, it's local decision, and we provide the support regardless of who it is. And whether it's a private not-for-profit or a municipal-based fire service, we don't distinguish between either, and we support everyone to the best of our abilities. So, okay, thank you. Sure. Any other questions?
You got off easy.
I did, yes.
And your ERs?
So they found out in the same press release we did. And we immediately had phone calls from both of the hospitals that we serve, wanting to make sure that we weren't going out of business. Because as you can imagine, that first press release that came through, everyone's like, "Whoa, where's Rescue going?" Rescue's not going anywhere. Rescue's going to continue to be here. We're going to continue to serve the remaining member towns, and we're going to serve the hospitals. But yes, the hospitals were not quite as quick as the reformer, but they were right behind looking for a comment about whether we were going to be able to continue providing that hospital transportation. And we certainly are going to be able to do that, and we're going to continue working hard to make sure those patients get where they need to go. As far as law enforcement, I have no comments about them.
I'm getting a number of calls, and people not only from Brattleboro, but from outlying towns. And they're saying the reformer and the town commons is giving them the impression that all Rescue is doing is transporting, and the fire department is doing all the medical stuff. And they're asking me, why does the fire department always get there ahead of Rescue? Are you guys lax? And we used to get out of this building in a minute. Probably better than that now.
So the answer to that question is we get out of this building really quick. Depending on where the call is in the town of Brattleboro. So if it's on this end of town, then we're first. If it's on Main Street, then the fire department will beat us there. If it's on the north end of town, then we go up the interstate and we will quite often be on scene before them. We did some analysis a couple of years ago, and the average time difference between arrival on the calls where the fire department arrives before us is just over 1.5 minutes. And just to put it into perspective, Mark Considine, who's sitting in the back of the room, who I already mentioned with his 30+ years of experience, it takes Mark 6 minutes of appropriate patient assessment before he makes a decision to provide clinical treatment. No different than when you go to the hospital. When you walk into the hospital, the doctor doesn't come running in with a needle and stab you. The doctor comes in and makes an assessment, a treatment plan, and then moves on. So the answer to that question is those treatments are being done by the qualified people on the ambulances that have done the appropriate clinical treatment assessment to determine what that treatment is. So there are occasions where we may be delayed. So an ambulance may be coming from somewhere up on Route 30 as we move our resources around and backfill different areas. So there may be times where those fire departments do have to provide that level of treatment. In Putney, for example, because Putney's a lot further than Brattleboro, when we arrive in Putney, that assessment has been done. Quite often, the clinical treatment course has been started. So in Brattleboro, not very likely. In Putney, every single day, because they're further away. And we expect that when we arrive, quite often those patients are assessed, treated, and waiting for us to kind of take over. Other questions? Anybody else want to speak? Anybody from the staff have something they want to say? All right, over here, I think it's important to understand what it is that we do. So I've asked the training staff to put out some equipment. We operate our own high fidelity simulation. So as part of what we do for training, the simulator that you're looking at actually breathes. Not does it actually breathe, but it actually breathes air and expels carbon dioxide the same as a human being. It creates waveforms that can mimic different respiratory complaints, whether it be asthma, COPD, bronchitis. It allows the healthcare providers to take a case, program the machine, and it will actually interact with them. When you give that mannequin medications, it knows what medications you gave, and it responds accordingly. If you gave it a medication that speeds up its heart rate, it will speed up its heart rate. Slow it down, it will slow it down. It has its own blood pressure. It's kind of creepy when it talks to you. So the level of education and continuing quality assurance that we do with this high-tech equipment is what keeps our people on the cutting edge of EMS delivery. This is how we maintain our skills. We don't have to go anywhere. We don't have to travel around the country. This lives in our training department, backed up by 25 years of paramedic experience to walk these people through what it means to do EMS. So take a minute if you don't mind, and at least go over, talk to them, talk to the car seat folks, talk about pediatric safe and what we've done to make sure our ambulances are safe for the smallest members of our community. Because there's more to it than throwing a kid on a stretcher and taking him to the hospital. They're not little adults. There's a lot to taking care of pediatrics and making sure that you're doing it appropriately. So I thank you all for coming out. I certainly thank our guests. Will drove all the way down here from Burlington to be here with us tonight, so I appreciate him taking the time to drive down here. It's always a pleasure to have Vern in the building. He likes to keep me in check. So thank you for coming, and I'll be wandering around. If there's any questions you didn't want to ask in public that you want to ask, feel free to grab me.
Thank you.